Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebook Live updates. It's September 11th, certainly a historic day for the U.S., and certainly a terrible day here in Douglas County with all the fires and all the smoke that we have. Nonetheless, we're going to carry on with our Facebook Live update, talking mostly about COVID, but we'll also talk about wildfire smoke and about the fires. This mask, as we try each time a new mask, this is a mask my wife made. This is, I think, my favorite so far. Fits nicely, doesn't fog up the glasses, so I think we're getting better and better at this. And we'll take the mask down so that people can see my lips if who reads them. So we have a little in the background here. That's all right. Okay, so again, Dr. Bob Dannenhoffer. Let's start off with a little bit about the fire. There are two large fires still active in Douglas County. The Archie Creek fire, which was out 138, which were two fires that merged together. That is now being managed by the Northwest Interagency Team 9. And so this is a federal team that's come in to help us with that. And if you need information about that fire, if you go to Archie Fire Info, A-R-C-H-I, Fire Info, phone number 971-334-7674, and we'll post that on the chat here. The French Creek Fire, which is a fire on this other side of Glide, is being managed locally by the Douglas Fire Protective Association, and you can find information from them on the DFPA Facebook page. And then evacuation in the county is being held by the Sheriff's Office at the Douglas County Sheriff's Office. Now, I was told last time I kept saying DSCO. It's DCSO, Douglas County Sheriff's Office, and again, their Facebook page will tell you about evacuations. There's also the Thielsen Fire, which is out by Diamond Lake. That's being managed by the Forest Service, and again, you can find that on the DFPA stage. So when you look here to have these three enormous fires all going at once, at the same time there are enormous fires to the south, to the north, and then further in Washington, California. This is truly an historic time. And looking out the window here, usually we've got 5, 10, 15, 20 miles visibility. I don't even think we have a mile at this point. The air quality is poor with high levels of particulates that you can smell and almost taste at this point, so this is a worrisome time. From a public health point of view, we want people to stay safe, and the first way to stay safe is pay attention to what the Sheriff's Office says. If they tell you it's time to get ready to evacuate, get ready, and when they say it's time to go, it is time to go. We've had people stay a little longer than they should and then requiring rescue, so please listen to what they say. From a public health standpoint, the biggest risks of fire are going to be about the smoke, and especially that's bad for people with pre-existing lung disease, old people, and children. So the best thing to do when there's a high level of smoke is to avoid it. Stay inside if possible with the windows closed. Use an air conditioner, an air purifier, or a HVAC system that's got a high level of filtration. Trying to avoid heavy activity and exercise during this time. We're thinking that the smoke is going to decrease by Monday, but we're still going to have a pretty nasty weekend with that. So we'll answer some COVID questions and do it, but as we normally do, we start off with a briefing about how things are going in the world. So this is still a really active pandemic. So in the week, we've gained 2 million cases in the world, 916,000 deaths. The new cases and the deaths are still really high. India especially is a big worry. They've had almost 100,000 cases a day in the last week or so. So India is really causing lots of havoc. And, the states in India are large, but have so many people in them. Brazil is still very active. The U.S. still very active. All of South and Central America is really struggling with this. And 3 countries we've not mentioned most, Spain, the Philippines, and Indonesia, 3 countries that are battling little upticks, so we're worried about that. In the U.S., we're at 6.5 million cases, about 196,000 deaths. The thought is we're going to hit 200,000 deaths within the next week. California, Florida, and Texas, we've been talking about for weeks, still very active, but now coming into this Tennessee, Illinois, West Virginia, and Wisconsin. So all of those areas today really starting to blow up in the number of cases. So just as we think we're kind of seeing some light at the end of the tunnel, it's the oncoming train. Oregon has been quiet. We've been at 28,000 cases. I think we'll hit 500 deaths today. But overall, it's really been quite a downward spiral. Okay, hold on a second here. All right, so kind of a downward spiral. Douglas County is the one bright spot in the state and the one bright spot in the country. We've been really quiet. We've had 3 cases in the last week, 3 cases in the week before. We have the lowest rate of anywhere in the state. So low, in fact, that schools are now able to open, and so that's great. And that's especially a great time to have a low rate, because we know with the fires, as people begin to congregate, as people are forced from their homes and forced to live with friends or families and increasing family sizes, this would be a treacherous time to have a high rate of disease. So we're lucky that the rate is low. Now, one of the things we always follow is the positivity rate. So for 100 tests, how many of those are going to be positive? And you know, for months and months and months and months, I've been talking that really the most important thing is not the number of tests you're doing, but driving that positivity rate down and down. So still in this country, the positivity rate is still 7.3%. And the positivity rate, even over this last week, is still very high. Douglas County, we're way under 2%. And in the last 3 weeks, we've been under 1%. So that's what we need to do. Really drive it down by continuing to test and find fewer and fewer new cases. Great, let me get some questions. So Matthew says, did the fires kill COVID? Oh, I wish it did. So, I mean, likely within the fire, if there was a COVID virus in the fire, these fires that were hot enough to melt cars likely melted any COVID virus that was in its way. But certainly around the fire where people are alive, it didn't do anything. So, how are employees wearing lace masks being allowed to wear them? Shouldn't businesses be made to follow guidelines? So there are guidelines, and we would like people to wear masks. They're going to stop the flow of air. So again, if you can blow out a candle through your mask, it's probably not doing much for you. It's really hard to enforce these things. I think employers can certainly enforce them with their employees. It's really hard, I think, for businesses to kick out paying customers who are not using masks appropriately. Still, though, the use of masks has been pretty good over the last little bit. I have looked, I've been following this since the beginning where we had very low mask usage. And I think now, pretty overwhelmingly, I'm seeing masks being used, so that's a good thing. But again, if you're wearing a lace mask to kind of give the man the finger, please don't do that. I think there's really good evidence that masks really do work. So if COVID is so dangerous, why don't we dispose of masks in the toxic waste bins? Again, remember, COVID comes and it's mostly droplets and airborne. Things that have COVID on them we don't think are particularly dangerous. So in fact, there's been some stuff in this last week suggesting that all of that maniacal cleaning of walls and floors and whatever is probably not all that useful, and is something that I've never really suggested that we do a lot of. Again, once the masks are there, the masks sit there, it's not toxic to pick up and touch, so we really don't need to do that. This suggests a level of, well, anyway, I'll leave it there. There are a lot of people who have needs during this time. Our hotline, which has been doing COVID, is also helping people with needs associated with the fire. But again, if you have questions about the fires themselves, I would go to the websites that we've talked about. If you have questions about evacuation, please go see a credible source, which is the sheriff's office. And then these other areas give pretty good advice. Okay, well, a couple things that came up. So over the months, people have been asking about the evolution of this virus, and I think now we've got some really good data to suggest that this virus does change, but changes slowly. So it changes far less than the flu. And if you look at the virus now compared to the very first virus they had out, it's 99.95% the same. So changes, but changes just a little bit. And rather than even new strains, these are really new variants. So we don't think they're big changes. The biggest change is the 614G. What in the world does that mean? Well, what it means is that there's a surface protein. The surface protein's got a lot of amino acids in it. In the 614 spot, there was a change of one nucleotide base pair that went from GAT to GGT, and then the amino acid that was coded by that changed from aspartic acid to glycine. So I had to look this up, but aspartic acid is sort of a long amino acid, and that allowed the surface protein to break off more easily. Glycine is a stubby little amino acid, and apparently the surface protein breaks off last, which means that the virus is somewhat more infectious, although not more lethal. So that it is changing. It's changing slowly. You know, people hope that it's going to change into a less virulent form or a less infectious form. I think that this would suggest it's going to change slowly, and probably genetic change is not going to be a big issue during the length of this pandemic, which we hope is only going to be a few years. Now, if you had a disease that was going to be over the space of 100 years, like measles, 100 years worth of change may be a lot. So what over-the-counter medicines are okay to take for COVID? Tylenol or ibuprofen. I was listening to a conference this week about ibuprofen. You remember early on there was a concern that ibuprofen might have a negative effect on COVID. That's been looked at pretty carefully. I hate to smoke. That's been looked at pretty carefully and doesn't seem to be an issue. A number of the people who take care of lots of people with COVID find that the aches and the muscle aches really do get better with nonsteroidals. So if you do have it, I think taking nonsteroidals is certainly safe. And that brings me to the new medicines that you hear, what should work and what's going on. So again, there's a bunch out there. There's a whole page here of medications that you might use. I think the ones that we do know work are remdesivir and Decadron. I think remdesivir probably helps a little, shortens the length of stay, may help a little bit with mortality, but clearly has a positive effect. Decadron is really the one that's got the biggest effect, probably decreases the death rate, decreases the rate of intubation. So Decadron, but you have to use Decadron after you're low in oxygen. If you use it too early or use it as a preventive, it actually seems to make it worse. Convalescent plasma, that's plasma you collect from people who've already had the disease. Pretty clearly safe. So they've given over 70,000 units of this, have not seen any big side effects. So probably safe. Whether it's effective or not, kind of up in the air. On small groups, there's a mild signal for effectiveness, but not a home run, certainly. What else is out there? There's ivermectin, which is this antiparasitic drug, which is very popular in Brazil. It doesn't seem to be working out that well for them. There was a tantalizing little study that's suggesting that it may decrease symptoms. I haven't seen it yet. Oleandrin, which is this substance from the oleander bush, no data. HIV drugs don't seem to work. Hydroxychloroquine, very adequately studied. I don't think they work. Monoclonal antibodies, that's an antibody from a person that's then replicated in the lab. They're trying that out in people in nursing homes. Haven't seen anything yet. Interferon, cytokine inhibitors, blood filtration, all not a lot of data to suggest that they work. So, still worrisome. Yeah, so what is the difference between COVID symptoms and smoke and fire symptoms? Some of these are going to overlap, and that's why we're worried about this. And let me also put flu in there. So, you know, is this COVID? Is this flu? Is this smoke? How do you know? Well, all three of them can give you a cough. However, the cough from smoke tends to be related to just that little dry tickle cough I have. Unfortunately, the cough from COVID can also be that dry tickle cough. The smoke may give you red eyes, it may irritate your throat, but usually doesn't make you feel sick. Whereas the people who have COVID really feel fatigue, weakness, muscle aches, but not everyone. GI symptoms, nausea, vomiting, diarrhea, very uncommon with smoke, but certainly could happen with COVID. Fever should never happen with smoke exposure. Definitely seen with flu, frequently seen with COVID. So sometimes hard to separate it. So if you do have questions, call your doc. So safety for COVID in shelters and big meals being served for evacuees. So I've been over to the evacuation center several times over the last few days, helping them with their safety things. They've done a really nice job. First they've tried to not have a zillion people in the evacuation center, so they've been trying to get people other places, say either outside in RVs, in tents, in hotel rooms, with other people, rather than being in a big crowded evacuation center. And then they've done a really good job of trying to space people apart. It's in Douglas Hall in the fairgrounds, which is sort of like being outside almost. It's this big, airy place, the doors open. So I think they've done about what they can to improve the safety. But again, the goal would be to avoid crowding, wear a mask when you need to. Okay, well, a couple of other things that came up. There's certainly going to be questions about vaccines. So there are a number of vaccines now in phase 3 trials. Phase 3 trials are sort of the last trials before you get these things approved. They're done in lots of people, so typically about 30,000 people in the group, and you very carefully look for side effects and what goes on. Well, this week, the AstraZeneca vaccine, which is AstraZeneca and Oxford put this together, which is one of the leading candidates here. One of the people in the trial got something called Transversemyelitis. So Transversemyelitis is rare, only a few cases a year in Oregon. And it's this autoimmune disease where your body kind of affects your spinal cord, and you get weakness and numbness and some paralysis in the area where you have the transversemyelitis. It's worrisome because autoimmune reactions are one of the things we worry about when we look at vaccines, right? Because what a vaccine is supposed to do is invoke an immune response. And so now to have an autoimmune disease in that thing is worrisome, and that's why they halted the trial. They're going to look carefully at this, and I think they're going to look very carefully to see. Now, some people just develop transversemyelitis for some other reason, and so it could be some other reason they got it, but that was a real setback for that vaccine. And it's not known if it's related to that vaccine itself, which was an adenovirus vaccine, and whether that's going to carry over to the other vaccines that are made in different ways. But that was clearly a setback in the world of vaccines. Another thing we talked about this week is the long haul. So there's been this sense that, oh, young people, most people are going to get this, it'll be over, they'll be better in a week. So we look back to the people who got this in February and March, and we called them in this last week and said, well, how you doing? And about 20% of the people were better, which is great, but about 80% of the people still had symptoms. Fatigue, hair loss, shortness of breath, muscle aches, persistent diarrhea, one person still on oxygen. So this wasn't, oh, I'm better in a month or so, that a lot of these people still had symptoms. And there was a really treacherous story in the Register Guard about this young woman who was a college middle distance runner, really about as good shape as you could be, and she got this 9 weeks ago, so short of breath that she was in the hospital for a few days, and still 9 weeks later is still really quite debilitated from this. So I think that the story that you'll just get it, and young people just get it, they won't have any troubles. Many will, but some really will get badly affected by this. All right, so it's kind of quiet, and I have just one more thing, and if we're done, we can be done. A couple more things. So one of the things that we've heard a lot over the months is, boy, I think I had this back in February or March, and we haven't really known. UCLA looked at sort of unknown coughs, and they think that maybe even as early as Christmas time in LA, there were a few cases, and there's a suggestion that there may have been a few cases in Seattle. Now, I don't think that accounts for the cases everywhere, but there may have been some disease circulating earlier. But you remember there was no test in the U.S. until almost February. So could it have been circulating before there? It certainly is possible. The other big thing is the super spreader event. So again, this is an unusual virus in that most viruses you give it to a few people, and you almost always give it to your family members. This disease, there are a lot of people don't give it to anybody. Get it, don't give it to anybody. But then some people get it and give it to a lot of people. So there's a wedding in Maine, indoor wedding in Maine, 161 cases and 3 deaths from this wedding. Ugh. There's one in Minnesota, there was a wedding, 70 cases from one wedding. So again, these super spread events are not predictable. Obviously, there are probably a lot of weddings going on where there are no spread. But to see that amount of spread in one event is truly shocking. Yeah, can you explain if there's any difference in the immune response of having the vaccine versus the disease? Yeah, so there's typically an enormous difference. So when you have the disease, you typically generate an immune response to every part of the germ. So there's many proteins involved in this, so you might generate an immune response to a bunch of it. If it's a blood-borne virus, which this one really isn't very much, but if it's blood-borne, you develop also really effective T-cell memory effect to it. Whereas with a vaccine, you only develop a response to what's in the vaccine. So for example, the Moderna vaccine and the AstraZeneca vaccine only have the spike protein in it, so you would only develop an antibody response to that one spike protein. And so the antibody response is likely better when you have the wild disease, but obviously much more dangerous. So what causes the long-term impacts of COVID? We do not know. We don't think the virus is circulating after a while. It may be that the virus screws with your production of what we call cytokines. So cytokines are these chemicals that cells kind of alert other cells to dangers and whatever. So you may know about people who have like mono, right? They get mono, they're tired, they're sick for a very long time. We think that's not because so much of the virus, but that the cytokines that it causes your cells to produce. And it may be the cytokines that come up from this, but we don't know. Some scary things about athletes with long-term heart disease, some scary things about people with long-term neurologic dysfunction following this. So there is some scariness there. All right. The last thing I want to go is on the doppelganger analysis. Remember, we looked at 4 counties across the country: Douglas County in Oregon, Twin Falls County in Idaho, Pennington County in South Dakota, and Lowndes County in Georgia, which is where Valdosta is. And so we looked and we found that Douglas County had far fewer cases, far fewer deaths than any of those areas. So I looked again. It's another 3 weeks out, so I looked again. And again, we still have far and away fewer cases. We've added 13 cases in the last bit. The other counties have added anywhere between 269 and 756 cases. Lowndes County added 19 deaths. We've added 1. The other thing that came out is people, when I did this, they said, oh, you should include the indirect costs of having the disease. And I said, oh, that would be complicated to do. You need to be an economist to do it. And they must have been listening, because that day came out an analysis about the true economic costs. Now remember, when we did it, we said the only direct cost was the cost of the hospitalization. And we said that was about $40,000 for people who were hospitalized. And we assigned no economic costs to people who were not hospitalized. We assigned no economic costs to the death. Well, these economists took it upon themselves to figure out what the cost is, and using the data that economists use, and it's a 37-page report that it took about a week to read because it is so long and so boring. But they use, for example, what the Department of Transportation uses as the value of an accident, the value of a hospitalization, value of a death, to come up with what it would be. And they said that deaths were worth $11 million. It seems like a lot of money. But that every non-fatal case was worth $46,000. Now this is many, many, many times what I projected. But then they also looked at the cost of the unemployment and whatever, and it's certainly more than just the cost of the unemployment payments. But when I put it together again using that, this is really costly for every county. In the analysis here, Lowndes County, which had unemployment plus lots of illnesses and deaths, per capita cost was $9,200. And in Douglas County, with far fewer cases, far fewer deaths, but more unemployment, was around 1,800. So again, no matter where you look, this is a terrible, miserable virus that has really caused lots of troubles. Okay, so Heather says, any thoughts on elderberry for cytokine? A lot of people like elderberry. I love elderberries as the fruit. Some people love elderberries for other reasons. Elderberries is certainly a very safe fruit. If you want to use elderberry, that's fine. I haven't seen any studies comparing it. So when do you recommend getting a flu shot? I'm 67 years old. Well, get a flu shot anytime you can get a flu shot. And again, the ideal time is 2 months before the flu comes around, but we don't know when that's going to happen. Since we don't know when that's going to happen, the goal would be to get a flu shot sometime in September, October, or November. Okay, well that's good. Everybody's busy, I know, with the fire and everything else. Again, a few things I want to point out. If you have questions, go to the reliable websites. There's a lot of craziness out there this week on Facebook. For evacuation information, Douglas County Sheriff's Office. For the Thielsen Fire and the French Creek Fire, the Douglas Fire Forest Protective Association. And for the Archie Creek Fire, go to Archie Fire Info. Again, there's a lot of rumors going on about how these things are spreading and other things that are happening. Please choose reliable sources when you're doing it. I hope we're a reliable source. As far as resources, we've had incredible work by people in the community. I was over at the fairgrounds today. There is just piles of water and food and diapers and really everything that people could use. And we've just been inundated with people who want to help, who want to go ahead and donate things. So if you can do that, please do it. Our hotline at 541-464-6550 is going to be up. We're again doing mostly COVID, but COVID and fire has overlapped a little bit. So if people have needs or whatever, they can call that hotline. We're going to go 8 a.m. to 7 p.m. at least through the weekend. Hopefully by Monday, the winds will have shifted, the air will be clear, and the fires will be stopped. But until that time, please, please, please be safe and please be kind. Again, this is Dr. Dannenhoffer, Public Health Officer for Douglas County. Thank you.